Welcome back, everyone. It is time for another segment of Megan and the Mayor, our new monthly series. Joining me is Mayor Leary and Gaylord Baird for the City of Lincoln. Mayor, thank you for being here today.
Thanks for having me, Megan.
Yes, I always enjoy talking to you each month, although I feel like we always have to start off with a little bit of a downer. We have to talk about COVID, and the pandemic. But there was some good news in the month of September. We saw a 40% decrease in our positivity cases here in Lincoln and Lancaster County. Now, hospitalizations remain steady, but I feel like it was finally a little bit of hope after so many numbers trending downward.
That's right. This is just more proof that our Lincoln community really cares and is taking the steps that are needed to get us on a pathway out of this pandemic. And I'm so proud of our community for taking seriously the measures that can help protect folks. The case numbers, as you said, for the month of September dropped 40% on a weekly average basis. And they're still high. They're still too high to get us out of that risky zone on the risk dial. But we are seeing progress, and that's important for keeping kids in school. It's important for supporting our businesses, and of course, it's important for keeping people healthy. So it is good news. As you mentioned, hospitalizations are holding steady. That is a lagging indicator. It is also something that reflects the fact that we, in our hospitals in our community, welcome people from outside our county. About half those hospitalizations are Lancaster County residents, and increasingly they are from outside the county where they don't have measures like mask mandates in place. We hope that we can continue to care for folks, but bring those numbers down and give some relief and some support to our frontline medical care workers. They're pretty tired.
Yes, absolutely. And you mentioned it right there, the mask mandate. It was recently extended until October 28th. If folks maybe missed the press conferences that you held explaining that decision, could you touch on that again as to why it was extended?
Right, we still just have really high spread in our community, and so if we want to see those hospitalization numbers come down, because they have held steady at a very high rate, we've got to get our case numbers down. There's a connection between the number of cases and the lagging number of hospitalizations weeks later. So we got to bring them down. We're still seeing too many each day and each week. And luckily, the masks are working. We've seen that over the month of September. We should start to see improvement in our Lancaster County numbers in the hospital. We are starting to see that. But unfortunately, our hospitals are bursting at the seams. Our emergency rooms are often full. We want there to be an ICU bed if you need it. If you have a heart attack, if you're in a car accident, we want to make sure that all residents of Lincoln have the emergency care that they need. And right now, as we've curtailed elective surgeries, as we see the busyness of our hospitals, we know that not everyone's necessarily guaranteed the care they need. So it is important. It is so important for residents to take precautions to slow the spread of COVID-19. And the best way isn't to mask, even though we want people to mask up for now. The best way is to get vaccinated. And the more and more people that get vaccinated, the more we have a pathway out of this pandemic. And I'm so pleased that about 74% of our 16-year-olds and older in our community are vaccinated, but only about 60% of our entire population has gotten their COVID-19 vaccination. And that means there are about 66,000 people in our community who are more vulnerable to this virus and also more capable of spreading it. And so we need to try to get more and more people vaccinated as soon as possible, especially heading into winter.
Yeah, health officials have really talked a lot about with the flu season coming and the pandemic, how that could be even more scary, than we are right now. So if we can get those numbers down, it'd be great going into winter. Also, I want to ask you, is there anything new on the outlook for the city when it comes to the pandemic, including booster shots and the rollout of those for certain populations who are eligible?
Yeah, our health team is ready to go as new information comes down from the federal government, for the CDC. We are ready to act. And so, for instance, last week, the health department held about 3 different booster clinics and got about 3,000 people their booster doses. Of course, those vaccines are also available through the pharmacies, and so as we look to see whether or not the vaccine will be approved for younger children, that ages 5 to 11, we are making preparations with our pediatricians in our community, our medical community, to be ready to, again, administer more doses as quickly as possible to get as many people protected as possible.
going into flu season here, how important it is to be getting your flu shot as well as any of those boosters if you're eligible, and that it is safe to get them at the same time?
Yeah, according to Health Director Pat Lopez, you can get both the COVID-19 vaccine and your flu vaccine at the same time. And we really are encouraging people to get their flu shots. It's so important going into winter. We really want to keep the pressure off of our hospitals, and we want to keep people healthy. You know, last year when we had the mask mandate in place for longer, we saw almost no cases of the flu. It was remarkable. That helped with our hospital capacity back then. Now that we're in this moment where our hospitals are very full, it's very important to try to keep people who are flu patients out of the ICU room so that we can continue to care for COVID patients and anyone else who has emergency care needs.
And a big announcement this week was, of course, the $7 million being allocated through the American Rescue Plan. Great news for small businesses. My question with that, though, what determines a small business? Is there certain stipulations on employee numbers that help with that, or maybe how much income that business has? How do you determine a small business?
Well, for the purposes of this small business stabilization grant program that we're using federal American Rescue Plan dollars to support, a small business is defined as a business with 50 or fewer employees. And to be eligible and comply with the dollars requirements from the federal government, they need to be able to show that they have had lost revenues during the pandemic. And we know our businesses here and all across the country have been hit hard, and we're attempting to help them stabilize and get back on track to grow and thrive. So encourage anyone who is eligible, any business owners, to go to our website, lincoln.ne.gov, and search for ARP, American Rescue Plan, and look up information about our small business stabilization grant program. And I would say these are grants. They are not loans. They don't need to be paid back. And businesses are eligible for up to $60,000 over a 6-month period to pay for rent or mortgages that maybe will then free up cash to focus on workforce demand or other improvements to their businesses that would be helpful as they get back on track.
Yes, we've heard so much about that labor shortage recently and just not having the employees to run these businesses. So yeah, definitely some great relief for them. And also with that, with the small businesses, once you have all of them apply, what determines who gets the grants and who doesn't?
You know, it's a first come, first served basis. So if you're eligible, you'll be eligible for this funding, and if you're first in line, you'll be the first one to get the money. So the application process opens on October 18th. We'll be sharing more information before then about how to apply. But again, in the meantime, you can go to our website at lincoln.ne.gov and look up ARP, and you can find more information about how to get ready for that process.
Obviously, the application process isn't quite open yet, but have you heard any feedback from small business owners you might know or have run into on the streets that, like, wow, like this is the relief we needed? What a wonderful announcement this week.
I actually did. I got a really powerful message from some folks I know who run a dance studio. And they said, you know, we took the precautions. We have done virtual dance classes. We have worn masks. We have done everything we know how to do to keep our dancers and our teachers safe. And this is such needed relief, and we're so grateful for this opportunity to apply for some resources to help bounce back from lost revenues over the past year. So yeah, we are hearing from people right here in our community about how wonderful this opportunity is. And we're so grateful to be able to do this to support our small businesses. I had convened an economic recovery task force last year, and one of the recommendations was to provide direct assistance. Now that we have the money in hand, we are preparing to get it out as quickly as we can.
Yes, those small businesses, I feel like, are what make Lincoln, so we have to take care of them. So that's wonderful that you're hearing great feedback. Finally, tonight, too, I want to talk about the Greenlight Lincoln program. For folks who maybe aren't familiar with it, do you just kind of want to explain what that is?
Yeah. Greenlight Lincoln is a program to improve our traffic flow in Lincoln, and that's important because we want people to get where they need to go as quickly and efficiently as possible and not be frustrated by a commute. We certainly want people to get through the community more safely. So it has been an effort underway since 2016. It's happened in phases. We just recently completed the 4th and final phase of improving traffic signals and updating them, of making them smarter and better timing. We've including building roundabouts to help reduce the kind of idling time that drivers experience on their commutes. It's measures like these that have helped reduce the time people spend in their car It's helping to reduce the amount of money they pay at the pump on gas, and that's, good for pocketbooks, and it's good for our environment. So we're really pleased to have achieved this milestone and want to be clear with the traveling public that we will continue to make improvements based on the emerging changes in traffic patterns, because we know that just like the weather, they change too.
Right, and I do know there's still some construction projects going on, especially in my neighborhood out on West A. They're still working on that. But I guess in the entirety of the program, of all the changes that you've collectively decided on right now been implemented?
So 90% of our traffic signals have been updated, and based on the traffic engineer's analysis of where we need to make improvements, we do traffic counts all the time. We have completed the fourth and final phase. So now, from here, they won't stop. They will continue to monitor and see where we may need to make adjustments based on, for instance, the fact that the pandemic has really changed the way people use transportation in our community or how much they drive. So yeah, we'll continue to tweak and refine to continue to make traffic flow in our community as efficient and easy as possible.
Gotcha. Okay, I just wanted to make sure that that part of the program was complete. So that's very interesting. Thank you, Mayor, for taking time to talk to us again today, and I look forward to next month.
Thank you, Megan. It's always a pleasure.